Hi guys, I'm Dr. Kirir from Let's Talk GP. Welcome back to the channel. Please like, subscribe for more content like this. So today I'd like to talk to you about Wegovy. You've probably no doubt heard in the news regarding Saxenda and more recently regarding Ozempic. But did you know about Wegovy? Interest in Wegovy and other injectable weight loss management options like Ozempic have actually started back in October 2022, where there was a famous post with Elon Musk commenting on losing weight as a consequence of fasting and also using Wegovy. Now, as a consequence of this, we've noticed a massive influx in requests for this. And did you know there are shortages in Ozempic around the country, not only in the UK, but in other parts of the world as well? Ozempic is a class of medications known as semaglutide, which is for diabetic patients. However, it's also used off-label for weight loss management. Wegovy, on the other hand, is a medication that's actually licensed for weight loss. Now, they both contain the same active ingredient, which is semaglutide, and the mechanism of action is by actually reducing appetite. Reducing appetite leads to eating less. Eating less would inevitably lead to losing weight. The UK government recently announced in June regarding a £40 million 2-year pilot study where they would be exploring how approved drugs can be made safely available to more people by expanding specialist weight management services outside of hospital settings. So this would be looking at how GPs could safely prescribe these drugs and how the NHS can provide support in the community or even digitally. There are a number of recommendations issued by NICE for the type of patient that this treatment would be suitable for. They've mentioned firstly that the treatment is only suitable for a maximum of 2 years and it should be carried out within a specialist weight management service providing a multidisciplinary management approach of overweight or obesity patients, and usually that means it's a tier 3 or tier 4 service, which are generally specialized clinics, usually in a hospital setting. They go on to say that you need to have at least one weight-related problem. That means it's caused by weight, for example, high blood pressure, diabetes, or even high lipid levels. And also, your BMI needs to be more than 35. If it doesn't meet that, then they have a lower threshold of BMI if your BMI is between 30 and 34.9 and you meet certain criteria to be referred initially to the weight management service, then you also tick the box. They then go on to say that actually we're allowed to use lower thresholds for BMI if you are South Asian, Chinese, other Asian, Middle Eastern, Black African or Afro-Caribbean family backgrounds. This means that the BMI thresholds, which we mentioned earlier, can be reduced by 2.5. The other recommendation which NICE suggest is considering stopping semaglutide or Wegovy or another active form of this if less than 5% of the initial weight loss has been lost after 6 months of treatment. Clinical trials have been carried out which have shown that Wegovy is effective at weight loss. In a particular study, they were able to show that across a 15-month period, patients were able to lose on average of 15 kilograms. Overall, they demonstrated that there was a 5% loss in weight across the duration of the study. There are a number of conditions which would stop you from having this particular medication, including pregnancy, breastfeeding, if you've had a reaction to this medicine in the past, or even if you've had or a family history of certain types of cancer, including medullary thyroid cancer, or even another condition called multiple endocrine neoplasia type 2. Now, remember, this sounds very complicated, and there will always be conditions where you will not be allowed to have something, but the best scenario is to actually discuss this with your specialist, and also to read more in detail regarding this. So if you are using Wegovy, there are a number of side effects to be aware of, which we will put on the screen for you now. Now, remember, this list is not exhaustive, and it doesn't mean that you're going to get any of these side effects. Rather, it's a list to be aware of some of the potential side effects that you may notice. Remember, it's always important to have a chat with your specialist to go through these side effects, and also to have a look at the patient information leaflet, which goes through this in more detail. How do you give it? Well, Wegovy is usually injected once a week, and you can choose the site and alternate the site at different locations to avoid any skin reactions. Commonly, this could be the arm, it could be the thigh, it could be the stomach, and it just depends where you feel most comfortable. So to summarize this very short video today, remember there are a number of options out there for weight loss, and you will no doubt hear in the news regarding different forms, including Saxenda, Ozempic, and now even Wegovy. It's important to do your research. It's important to speak with your specialist. If you are interested in having any of these treatments, get in touch with your local team. Generally in the UK, these medications are usually offered by Tier 3 weight management services, and in order to access this, usually we would refer you to this service. And in order to be referred, you have to meet a certain criteria, and your local GP can go through that criteria with you. Finally, remember, there are also online services or online clinics offering these medications. Although Wegovy is not yet currently available, things will change soon. Finally, thank you very much for watching again. Please remember to hit the like, subscribe button, where we will bring to you more videos like this.